Hello everyone, welcome to today's session. If you are new to our channel, please subscribe it for the daily videos. Questions on these exams are taken from random various nursing concepts. Read each question carefully and choose the best answer. You are given 1 minute per question. Spend your time wisely. We will give 30 seconds for answering. Within this time, you have to comment your answer. After that, we will mention the answer with explanation. Answers and rationales are given below. Be sure to which individual is at greatest risk for developing hypertension. Your options: 45-year-old African American attorney, 60-year-old Asian American shop owner, 40-year-old Caucasian nurse, 55-year-old Hispanic teacher. Explanation: the incidence of hypertension is greater among African Americans than other groups in the US. The incidence among the Hispanic population is rising. A child who ingested 15 maximum strength acetaminophen tablets 45 minutes ago is seen in the emergency department. Which of the orders should the nurse do first? Options: gastric lavage, acetylcysteine or mucomyst, start an IV Dextrose 5% with 0.33% normal saline to keep the vein open, activated charcoal. Explanation: removing as much of the drug as possible is the first step in treatment for this drug overdose. This is best done by gastric lavage. The next drug to give would be activated charcoal, then mucomyst, and lastly the IV fluids. Next question: which complication of cardiac catheterization should the nurse monitor for the initial 24 hours after the procedure? Your options: angina at rest, thrombus formation, dizziness, falling blood pressure. And explanation: thrombus formation in the coronary arteries is a potential problem in the initial 24 hours after a cardiac catheterization. A falling BP occurs along with the hemorrhage of the insertion site, which is associated with the first 12 hours after procedure. A client is admitted to the emergency room with renal calculi and is complaining of moderate to severe flank pain and nausea. The client's temperature is 100.8 degree Fahrenheit. The priority nursing goal for this client is: your options: maintain fluid and electrolyte balance, control nausea, manage pain, prevent urinary tract infection. Explanation: the immediate goal of therapy is to alleviate the client's pain. What would the nurse expect to see while assessing the growth of children during their school age years? Your options: decreasing amounts of body fat and muscle mass, little change in body appearance from year to year, progressive height increase of 4 inches each year, yearly weight gain of about 5.5 pounds per year. Explanation: school age children gain about 5.5 pounds each year and increase about 2 inches in height. At a community health fair, the blood pressure of a 62-year-old client is 160/96 mmHg. The client states, "My blood pressure is usually much lower." The nurse should tell the client to go. Your options: get a blood pressure check within the next 48 to 72 hours, check blood pressure again in 2 months, see the healthcare provider immediately, visit the healthcare provider within 1 week for a BP check. Explanation: the blood pressure reading is moderately high with the need to have it rechecked in a few days. The client states it is usually much lower. Thus, a concern exists for complications such as stroke. However, Immediate check by the provider of care is not warranted. Waiting 2 months or a week for follow-up is too long. Your next question. A client has been newly diagnosed with hypothyroidism and will take levothyroxine or Synthroid 50 mcg per day by mouth. As a part of the teaching plan, the nurse emphasizes that this medication, and here your options, it should be taken in the morning, it may decrease the client's energy level, it must be stored in a dark container, it will decrease the client's heart rate. Explanation. Thyroid supplement should be taken in the morning to minimize the side effects of insomnia. If you have any corrections, the above stated options or questions, you are most welcome to comment it. We are expecting better information from your side. Thank you all. Have a nice day.